I shot a video many years ago on watershed zones, and I think it's a helpful understanding. And essentially what it is that when we look at the aging face, we can distinguish between bone and soft tissue. It is very obvious when you see bone. You know that's bony and you know that's soft tissue. The problem today, that has, I think, scared a lot of people away from soft tissue augmentation, whether it's fat or fillers, is these pillow faces, these way over augmented faces. The other problem, though, is honestly, if you do fillers right and do it well, is you may not have enough product, and it gets very expensive. With fat, it's nice because there is no limit. You can harvest the fat and do what you want and cover the area you want. But with fillers, it can get quite expensive when you're just using fillers to try to augment it. So when I try to do a face, I try to get the maximal impact, of course, natural. And the way I do it is to hit what I call watershed zones. Essentially what that is if you think about the visibility of a bone that's there, the way that we can see that's bone and not soft tissue is that the bone edge, where there's an edge drop off, that edge is what defines our brain to see, oh, that's bone and not soft tissue. So instead of augmenting an entire cheek, and by the way, if this is not clear, I don't put fillers or fat in the central anterior cheek, which is a darling area for everyone else, but it's an area that I absolutely hate because I think it makes people look weird and overfilled, especially when you smile. So for me, I want my patients to look natural when they don't smile, but also when they smile, that they look natural all the time. So what are these watershed zones that I'm talking about? So for example, the most classic for me is if you look at the zygomatic arch. When you look at the zygomatic arch in the temple, for example, there's a step-off point where this drops off to the edge. So instead of just filling the whole area or filling the cheek area, I'm hitting just the zone where the bone exposure is. That allows me to put a half a syringe in or a syringe in, and it still looks amazing versus having to put 2 or 3 aside and get very cost prohibitive. Other examples of watershed zones, for example, would be the conjoined tendon. That's the tendon that basically separates the forehead from the temple, and that edge is visible as a delineation of bone exposure. So I just soften that conjoined tendon. Many different examples of bone edges. I don't really do a lot of under eye filler anymore because I've mentioned this before that I've seen some migration issues over time. Fat is my go-to around the eyes. Other watershed zones, if you're looking at the mandible jawbone, sometimes you'll see just the edge of the mandible as it starts to sink in this zone. To fill the whole anterior chin is quite difficult, but if I can just hit that transition where it goes down, you can soften that edge without a lot of product and still make someone look good. So the goal of these watershed zone treatments is to manage bone exposure and to allow one to see soft tissue. And when you see soft tissue, you see more youth.